Welcome to Deuk Spine Institute. I'm Dr. Deuk Majin, CEO and founder. We are here today on June 17, 2025. Our patient travels from Canada to Florida for this procedure. He's been suffering with back pain for several years. The back pain is localized to the L23, L34 disc. When I looked at his MRI, I could see he had the annular tear with the herniation stuck in the tear at L23, L34 with some bulging, disc bulging. Now, it turns out that one of the tears is more on the right side and one is more on the left side. The L23 is more on the left, the L34 is more on the right. These are bulging discs, mind you. What does that mean? It means that the discs are not massively herniated. Most doctors wouldn't even notice it. But he had pain coming from that area, and I'm convinced that that's where his pain's coming from. So we offered him the Deuk laser disc repair. Deuk laser disc repair is a quick, safe procedure that deals with discogenic back pain. All right, let me focus for a moment while you, Henry, show our audience the 30 different sources of chronic back pain that we can now fix at Deuk Spine Institute. I'm Dr. R. Deuk Majin with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Machen. Thanks for joining us. All right, welcome back. You can see from our video there are 30 very specific causes of lower back pain. And the most common of the 30 are disc injuries such as herniated disc, bulging disc. Our patient now has the 2 needles placed, one at L3-4, one at L2-3. We are ready to get started. He is a bit agitated, and we were going to wake him up and do our discogram, but he is not really cooperating. Are you awake?
Are you awake, my friend? Can you open your eyes? Yes? Wiggle your finger, your left fingers. Excellent. Wiggling your
Are you having any back pain?
You having any pain in your back? Yes or no?
Yes or no?
You don't have to answer.
So he's had back pain for over 2 years. Is your back hurting at all?
Does that hurt?
No? How bad is that on a scale of 1 to 10? How high?
Give us a number.
How high?
1 to 10. What'd you say? 8.
8 was the highest? All right. So at L3-4, you had an 8 out of 10. Is that where you get your back pain? Is that where you get your back pain?
Is that where you get your
Is that where you get your pain?
pain? I think you said yes.
Yep. All right, good. So concordant, 8 out of 10. Is it better now? Hey, buddy, we're almost done. We're going to put you back to sleep. I just need your help. Are you having any pain? All right.
Pain right now?
How bad is that on a scale of 1 to 10? How high?
What's the number?
Oh.
What's the number?
I heard 10. Is that where you get your pain? Yeah. All right, good. You can put him down to sleep. All right, so, when I interviewed this patient, he was in Canada. We did an MRI review. His pain was here, and I knew that it was higher than the L5S1 or L45. I looked at his MRI. I saw 2 discs that were damaged. I knew they were causing his back pain. He didn't have any facet pain or any SI or piriformis. So we went straight for repairing the 2 discs, L2-3, L3-4. Again, all this diagnosis was made through what's called the MRI review. And this is done virtually through Zoom. Anybody can do it, wherever you are. It takes 10 minutes, and Deuk Spine Institute will tell you exactly why you're having your back pain or neck pain. Most people that we see have back pain. We get around 3 out of 4 patients are back pain patients. 1 out of 4 is neck. We rarely see thoracic, but it does happen from time to time. I've placed these needles and tested these 2 discs. They are both painful, and they're his typical pain he gets every day. So I'm encouraged by that. I'm excited for him. I think he's going to do fantastic. We've just got to get the surgery done. Now, some people tolerate the anesthesia better than others. Has to do with their physiology, we call it. Has to do with a lot of factors, but some of it's just how their body's built and wired to respond to the drugs of anesthesia. You can see the herniation. Jordan, show them the herniation at 3-4. Yep, that's it, the black thing. And then show them the tear in the back of the disc there. Yep, there's the tear that we're going to fix. Show them the other tear. There's the other tear. Now that's where all of his back pain's coming from, are those 2 tears. And that's what we're here to fix today. Any questions?
At this moment, no current questions.
All right, let me just tell you, this is the safest, most effective surgery in the world to cure back pain from a disc problem. And that's what he has. Most patients, their pain is coming from a disc problem, like a herniated disc, bulging disc, ruptured disc. That's exactly what he's got going on. So I just cut his skin 1/4 inch. The rest of the body underneath the skin is not being harmed in any way. We're putting a dilator down. It spreads the tissues apart. All of your tissues are fibrous. Fibrous means they're made out of fibers, okay, like muscle fibers, collagen fibers, elastin fibers. Everything is fibrous except for the skin, and the disc itself has a giant tear already. We just went right through that tear that was already there. So people ask me, don't you damage the disc when you do the surgery? And I say no, because we're literally going through a damaged war zone already, which is why the patient has so much pain. Is this a new drape?
He said yes.
It's nice. I like it. You like it?
I like it. It's cheaper.
No, good. I like that.
Can you check if I'm right there or I'm in the wrong spot?
Mm-hmm.
Because I can actually see it.
Uh-huh.
Can you turn around number 2, please?
I'll be able to tell when I get in. Let me see here. Grabber. Oh, look at that inflammatory tissue right there, guys. See the pink stuff? There's blue, which is the Deuk spine dye that stains the herniation. And then you see the pink color right there. So this is part of the herniation. It's where his pain has been coming from. I'm really excited for this patient from Canada because we're going to eliminate this back pain for him with this surgery. I'm so excited for him. All right, any questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain and how it is that we cure it.
I think it's a great idea.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4 inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Thanks, Henry, for showing us some great video footage of, yeah, it's reversed. So I'll just hold this here. Go ahead and flip it. Flip this. Here. Hold on. Go ahead and flip it around. So you saw from the video that the way a disc injury causes back pain is that the herniation gets stuck in the tear in the wall of the disc. And once it's stuck there, It literally just causes severe inflammation. Inflammation is your body's attempt to fix a problem. Typically, inflammation is what your body uses for a few things like healing a wound or an injury. For example, if you fall and break a bone, you're going to get inflammation right where the bone is broken. That inflammation will clean out that area in the bone where it's damaged and get rid of all the dead bone, and then it'll build new bone back. And the inflammation part of it is the part that cleans out the bone that's damaged. The building new bone is not part of inflammation. It's actually part of your body's repair system. But you can't repair a broken bone without inflammation. You must have inflammation. Also, if you have a bacterial infection in your body, the body fights the bacteria with inflammation. Look at the tear right there. See the blue? That blue shows you the tear. The white on the right is the torn fibers, and they're torn right there. So that's the left and the right. They're supposed to be together, joined together, but the tear is pretty big, and the blue stuff is the herniation stuck in the tear. Now, what it does is it creates inflammation. It stimulates inflammation, and the inflammation then comes in and starts fighting the herniation, thinking that it's got to get rid of the herniation. But your body can never get rid of that piece of herniation because it's not possible to dissolve it away. You don't have enough of an inflammatory response, because there's avascular. The disc itself doesn't have much blood supply. So you can't get a robust inflammatory response to chew it up and get rid of it, the herniation. So basically it just sits there and keeps antagonizing your inflammatory system, causing inflammation. Well, the inflammation itself is not a huge problem, but what happens with chronic inflammation that just keeps going is that your body starts to grow in scar tissue and tiny little nerve fibers, and that process is called neoneurulation. Neo is new, neurulation is new nerve fibers, and you get this neovascularization with new blood vessels. So you get new nerve fibers, new blood vessels, and you get the ingrowth of fibroblasts and macrophages that come in and just start doing their job. First, the macrophages and PMNs, they come in to destroy get rid of the devitalized tissue, and then oh, look at that piece of herniation. That thing's huge. All right, we're gonna have to show this one. Get the light on. Oh, it's a big one. Look at this herniation. You guys see this?
Yes, we do.
This was, what disc are we at? 3-4. Look at the size of that piece of herniation, folks. It's a giant one. And you see the blue color?
Yes, we do.
That blue is degeneration of the herniation. It's basically like acid washed herniation. The acid coming from your inflammatory response. That's a big one. Sometimes we get the big ones. Sometimes we don't. Right? So he's been suffering with back pain for a long time. He found us on, I believe, on YouTube, and realized, hey, I can go to Deuk Spine and get rid of my back pain, because nobody in Canada is going to get rid of this back pain. The Canadian doctors, frankly, they don't care about back pain. They don't care about you having back pain. It's just the God's honest truth. All right, there's that inflammatory tissue, more of it, the pinkish colored stuff right there, more tear right there. That's where we're going to laser away. Once I clean this up with the laser, his back pain will be gone. He's going to wake up and the back pain is gone. He's just going to have pain from my surgery. Any questions?
At this moment, no current questions.
All right, I like that. An audience that knows what they're doing. Well, since you don't have anything to talk about, folks, I'll talk to you about something. I caught an article, came across my desk, and it was titled Boston Scientific Recalls the Superion device. What is that? Basically, it's a company that manufactures a metal device that goes into your spine, and it turns out that that device is falling apart and it doesn't work. Now, the sad thing is, and this is a perfect example of what's wrong in our healthcare system in America today. Now, the biggest problem in our healthcare system is the insurance companies stealing your money and not giving you the coverage of procedures and treatments that you should be getting. And they call that a denial. They deny your treatment, okay? But second to that is the corruption we're seeing in the healthcare system, where big Wall Street firms and investors are basically buying these startup companies, these tech companies that have quote unquote great technology, like in the Superion device, which was originally called the Vertex device. And they think they're going to get rich by basically some scientist comes up with an idea, oh, let's put a piece of metal between people's spinous process, and we'll call it Vertex. And it's going to be used to treat a common problem called spinal stenosis. And it's great. So then they develop the device, they put it through FDA trials, and they put it in people, right? And then they basically doctor the data, they fake the data, they lie about it so that it looks like it works and that it's safe and that it can be trustworthy and effective at treating spinal stenosis, a very common problem. And then they publish those, early results that have been basically fabricated and fake good results, but really were bad results, but they didn't include the bad results in the outcomes of the study. And then they get a company like Boston Scientific to buy the device and pay, $500 million for it. And then Boston goes out and tries to distribute it, right? Now, the way Boston distributes it is they go to the pain management doctors. And by the way, pain management doctors, we got another herniation. Pain management doctors are not even surgeons. They're not supposed to do surgery. But here's the thing. Real surgeons won't put that device in. So what does Boston do? They go and create a new surgical field on their own of doctors who aren't surgeons, but are money hungry and want to make more money than they're making. Pain management doctors are not surgeons. Surgeons make more money than pain management doctors doing spine surgery because they've gone through the training and they've been vetted and selected and trained. So when spine surgeons won't put the device in, instead Boston goes to the pain management doctors who aren't really surgeons. And they use surgeons to teach the pain management doctors how to do surgery and put these devices in. Now, what motivates the pain management doctors is the money. So instead of doing an epidural steroid injection and getting $50, they go and they put in this Superion device and they make $2,500 or more profit. So they've gone from doing epidural shots, which they're supposed to be doing, making very little money, to getting offered to be trained to do a procedure that makes thousands of dollars in profits instead. So all these greedy little pain management doctors have climbed on board and pretend like they're spine surgeons doing spine surgery when they're not. And they start putting these Superion devices in patients. Over 20,000, 25,000 patients had this device put in. And of course, the device is garbage. And it's like a $2 piece of material that, they're basically having made in China for $2, and then they sell it here for $12,000. And Boston is making a killing on that. And the pain management doctors are making a killing. And the patients are suffering because they're getting this piece of garbage put in their spine that doesn't even work. And it's falling apart. And they basically just pulled it off the market. We're going to do an entire reaction video on it coming up. Henry and I are going to do a podcast on it.
Yes, we are.
Where we're going to talk about it. We're going to go through the scientific papers that were used by the FDA to approve the device. We'll go through some of the peer-reviewed publications. But basically, it's a piece of garbage that was marketed to the investors as a way to make a gazillion dollars because everybody's going to want one. He's moving a bit, Berndes. Long story short, now we got all these people who have these devices falling apart in their spine, that those devices didn't even do anything to help them. And people are basically like cattle right now with back pain. They just trust their pain management doctors. They're desperate. They're in so much pain, they'll do anything. And these pain management doctors are just abusing the patient's desperation and trust. And they're putting all these garbage devices in patients, spinal cord stimulators, interspinous devices, mild procedures, things that don't even work. And they're just doing it for the money. And patients, not knowing any better, are laying down and getting these devices put in them. Can we be a little more prepared? Long story short, it's harmful to patients. It's harmful to the medical system. Insurance companies have been manipulated into paying for these procedures that don't even work. So doctors are getting rich, hospitals are getting rich, the implant companies are getting rich, and the patients are getting robbed. And this is just one example of hundreds of devices and treatments that doctors use to treat back pain that don't work. Superion, look it up. It just came out in the news last week. It's being pulled off. It's no longer going to be available in America. I'm sure they're going to pull it in Europe and other countries as well. These are spine scams, my friend, scams. The manufacturers know it doesn't work, but they put it out there because all the other treatments they offer don't work either. So you might as well make some money on another treatment that doesn't work, right? Sounds like a new treatment. The patient hasn't had it done yet. Now they got another option, another way to scam patients, get them to have the surgery, make a big payday, and yet the patients suffer because they just had another surgery that doesn't work. It's quite disgusting, to be honest. Somebody's got to tell you guys about it, and you're not going to hear about it from the companies that manufacture the devices. You're not going to hear the truth from the surgeons and pain management doctors putting the devices in. You're not going to hear it from anybody because the system is working together to screw you, the patient, out of your premium money, your insurance money, and you guys, they don't get that insurance money unless they do something invasive to you. So that's what's happening. Deuk Spine Institute never did the Superion device because I knew it doesn't work. It's flawed. When it first came out, it came out as a device called the X-Stop. X-Stop didn't work. They fabricated the results of the studies. They basically made up the results to make it look like it works, but it doesn't work. Same thing with artificial discs. So many treatments that are being recommended and used today in medicine that don't work. Everybody knows they don't work, but they're big business and they're a way for companies to make huge profits off of you, the patients. Hold it. Just about done with our first disc, and then I'm going to switch sides and go to the other side. But we've pulled out some real humdingers here. You like that? The humdinger? Huh? People should come to Deuk Spine Institute to protect themselves. All right, there's probably a few other good doctors out there, but I don't know who they are. So when you ask me who, I mean, I can say Deuk Spine. Why? Because I'm the leader here. I'm the one who basically set the culture of this organization. And my motivation is to help people, help patients get out of pain through treatments that actually work to eliminate pain. So I know my own motivations are good. I can't trust most other doctors' motivations because they're not good. They're not good for the patient. They're good for the doctor. But I'm sure there's a few other good surgeons out there. I just don't know who they are. I know a lot of bad surgeons. I'm not going to mention any names, but I can't think of any good ones. I know hundreds of spine surgeons out there.
We have a couple of questions.
Sure.
This first one is coming from Charlie on YouTube,
Welcome back, Charlie on YouTube.
asking how long would you estimate it took for you to become fluent at the feel of getting that dilator properly into the disc space? It seems important to have done many procedures to be fluent.
Yes, Charlie, you're right. It is not easy. That is, I think the hardest part of the surgery is getting that needle in the right spot and not hurting the patient while you're doing it. That is the hardest part of the treatment, in my opinion. If you get that needle placed properly, the rest of the surgery goes just fine. How long does it take? I know it took me a few surgeries, maybe 5. And I'll be honest, I continue to learn, but I've been very fortunate that I have not hurt anybody with the needle or the subsequent dilator or tube. But it could happen if you don't put the needle in right. You can kill the patient very easily. So you're very right to ask me that question. It's something that I make it look really easy,
Go on, please.
but the reality is it's the hardest part of the surgery. And if you master needle placement, then you can do the surgery very easily. The rest of the surgery follows the needle placement. If the needle's placed properly, the surgery will be done properly. There's only a few ways you can hurt the patient. But the biggest risk to the patient is the needle not being placed properly. So it's great that you can understand that. And I do make it look easy. I mean, if you watch my surgeries over and over and over again, it looks like I just come in and stick a needle in. But it's actually something I have to use the X-ray machine, and I have a lot of experience and understanding of the anatomy. And I know where the things are that we can't hurt, and I know how to avoid them. And that takes a lot of experience and understanding of anatomy by the surgeon. But I don't talk much about it. It's one of those things you've got to actually be here to understand. So it took me a few tries. Someday I can open up about it, talk about it. I just can't do that right now. Right? I mean, oh, why not? What the halibut? So I had to learn, I hate to say this, but I took a cadaver lab with my original teachers who taught me this transforaminal technique. And then I went out and I did the surgery when I got home. So I took the cadaver lab overseas, and I didn't even put a needle in, because when I took the lab, when I took the course, when I went overseas to learn the first time, I missed the deadline to get in the lab, but I knew somebody who let me in. So they didn't actually give me a needle to put in. I just watched other people do it. And then I went home and I did my first case. And of course, that was 19 years ago. And I've done now 2,650, but I've never once misplaced the needle. And I do a lot of open spine surgery, so I understand the anatomy from the open spine surgery. I also teach anatomy at the medical school, so I've seen the spine opened up, in the cadaver lab, and of course I did my own anatomy at USC when I did my medical school training. So I guess you could say I learned hands-on, real world. Not the ideal situation for most doctors. All the rest of my spine surgery training, I trained next to a surgeon who guided me directly and watched my technique and corrected anything I was doing wrong at the time, but not with this endoscopic transforaminal surgery. I sort of did a lab and went home and did my first case. I've never told anybody that, but that is the truth. Nobody's really asked. And now I do it all the time. Obviously, I've done thousands. All right, great question. Okay, now give me 1 second. Let me just see. Feels good. Go ahead. So we are now at 2-3. And we're inside the disc. Hold on. So again, I went through the tear in the back of the disc. You can see where the tear comes to the back. And so we're not damaging the disc in any way. We're just going through an area. Is that sterile?
Oh, yeah.
We're just going through an area that's already damaged. But great question. Any other questions?
Yes, we have a question coming from Pure Honest, Very Caring on Facebook,
Sure. Welcome back.
saying, I have a question here. What is going on with pain management? Now the insurances don't want to pay anesthesia for IV sedation for epidural injections, and already the pain management has been downgrading their injections from 2% to 1%, and now they're being told they're going to be paid less than pain management doctors. So what are they going to start injecting us with saline? It's coming to the point where epidural is not working or having any effect as much as they used to.
You make an incredibly good point. So first of all, the insurance companies never paid for anesthesia during an epidural injection, okay? At least for the last 16 years. Now, there are some exceptions, of course. And your pain management doctor could argue that you have a phobia, a tremendous fear of blood or needles, and then they could use that argument to try to get the insurance to pay for anesthesia. But for the last 20 years that I've been practicing, it's been well known that insurance would not pay for anesthesia for shots, okay? And that hasn't changed. Unless you, the doctor, write a special letter that says the patient has a phobia or fear of needles and shots, and you'll pass out. So some doctors did that. We did that for some patients, but if you do it for every patient, the insurance will come after you and try to put you in jail for fraud, okay? That's what they do to doctors like that. So we have been doing anesthesia only for patients when they want it. We don't bill the anesthesia to their insurance. We make them pay cash because their insurance clearly states they're not covering anesthesia for shots, okay? As far as the medicine the doctors are putting in there, you're right. The doctors, first of all, they don't make much money for an epidural. They only make about $50 profit, okay? And that's if they run things well. So there's not much money to be made with shots. So putting sterile saline in there is something that a corrupt doctor would do. Of course, that's fraud and illegal and immoral. They shouldn't do it. But there are doctors that do it. And the reason they do it is you come and get the shot, they bill for an epidural, they save the money on the medication, so they make more profit. But more importantly, you tell them it didn't work, so then they bump up the next treatment to a mild procedure or to a interspinous device. So basically, by you not doing well with the epidural, they can have justification to go to the insurance company and ask the insurance company to pay for another treatment. And they get that treatment approved. So the insurance companies sort of did it to you, and they did it to the doctors, and they did it to themselves because they required you to have the shots first before you get a more invasive procedure that they'll pay for and they'll pay more money for. So what do doctors do? I'll give you an example. I've got a lawn here in Florida, a lawn, okay? And my grass, I'm looking at it, I'm looking at the bushes, and I've got a pest control service, right? I had Black's Pest Control. And they would show up with a big truck, and they would take a hose out, and they would start spraying the yard with chemicals to kill all the pests that eat your grass, eat your bushes and your flowers, and destroy them. But they're coming here and they're spraying my house, and I'm looking at my bushes and they're dying from pests. I'm looking at my grass and I've got chinch bugs and I've got all kinds of pests eating my grass, killing my grass. And I'm like, what the hell are you spraying? So what they do is they take your money for pest control and then they just spray water. You don't know any different. You just see something getting sprayed out there, but it's water. And basically they're saving the money on the chemicals, they're not paying for it. And if you're not checking your lawn and paying attention, then you're just getting water sprayed on your yard. So this whole concept of cheating people by, injecting water or spraying water instead of chemicals or, drugs, it's very common, unfortunately. But Deuk Spine Institute never does that. We spend a lot of money on our medications. We buy only the best, and we give our patients the very best treatment. Now that said, epidurals don't fix anything, and your pain is going to keep coming back, and they stop working after a while. So it's better to come and get this surgery, the Deuk laser disc repair, and get fixed so you don't need shots anymore. But yeah, medicine is falling apart because insurance companies are making it more and more difficult for doctors to get paid. So doctors are having to come up with creative ways to make money, and that's never a good thing for patients when the doctors are trying to come up with creative ways to make money. Because in the end, those ways require us to treat patients with more invasive treatments that pay better. And that's all due to the damn insurance companies, honestly, driving all this corruption.
We have another question.
Sure.
Come.
10 minutes. 10 minutes. You guys see the tear, by the way, right?
Yes, we do.
That's a pretty good sized tear right there. And the laser is going to come in and clean it up. If Nikki turns it on. Go ahead, Henry.
Coming from Faisal on Facebook.
Oh, Faisal. Faisal. Is this the same Faisal that I know?
It is the same Faisal.
All right. I'll take Faisal's question.
Asking, as your surgeries are day case procedures, how sedated are the patients? I am guessing they don't need a tube down their throat. By the way, screw shots, they don't work and it's unnecessary risk to patients.
Yeah, I agree. So Faisal, to answer your question, it is day surgery, you're right, but some of our procedures require general anesthesia where you do have to have a tube down your throat. For example, cervical disc surgery, if I do this laser surgery on the neck, it's just dripping on my feet. If I do this laser surgery on the neck, then yes, you must have a tube down. You're intubated under general anesthesia. But for the lower back, no. When we do these lower back surgeries, there's no need for intubation. It's propofol sedation. That's all. Good question.
And other than that, no current questions.
Well, Henry, then let's share with our audience the second most common cause of back pain, being the facets, and how they cause pain.
Of course.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. So we just showed you our facet joint pain video, which is really the second most common cause of back pain, facet joints. What are facet joints? They're small joints located in the back of the spine, just behind the disc. There's one disc right in the middle of your spine, and then there's 2 facet joints for every disc. So when you have a disc injury, you also have a facet joint injury. The joints work together with the disc to allow movement of your spine. The facet joints are the second most common cause of back pain in patients with chronic back pain. The disc is the first. All right, so far we've had some good questions. I'm almost done. A lot of herniation here. Trying to get it all out for this patient, so he has a great result. We're going to finish this herniation right here, and then look at that. Oh, almost had a big piece. Then we're going to move on to our next case. Our next patient has piriformis pain. Piriformis pain is pain from the piriformis muscle being injured in their buttock. And that patient travels here from where is he from? Cincinnati. So this patient is from Canada. The next patient is from Cincinnati, but the next patient's surgery is going to be done in our other operating room. We don't have the ability to broadcast, so there won't be any broadcast on the next one. But we will be back for one final surgery, our 6th surgery of the day. And the last surgery will be here in this room. It's going to be a 1-level Deuk laser disc repair. L45 maybe? L45 on the right. Any questions, Hen?
Yes, we just got a question from Charlie, once more on YouTube,
Thanks, Charlie, for keeping me awake.
asking, cervically you approach anteriorly. That means entering the disc where there is no tear. Is that a very small entrance that heals easily?
Yeah, great question, Charlie. So we are going through the front of the disc, and the truth is, when you have a tear in the back of the disc, you probably have a tear in the front. So those patients typically do have tears in the front, but front tears don't cause symptoms. They just never actually hurt. So we do go through the front. We typically go through a tear that's there. And more importantly, remember, we're not making a tear. We're going through a type of tissue that is fibrous, remember? We talked about that. Fibrous means that tissue is made up of fibers. You guys see the fibers right there? I'm working on them. You see these are fibers. You can actually see the individual fibers. So we're not going through a barrier that's solid. We're going through a fibrous barrier that has fibers, and we just go between the fibers. That's all you got to do is go between the fibers. Fibers spread apart, and then when you're done, you take out your instrument and the fibers come back together. All right, we're just about done here, and my tube, it keeps coming out because it's trying to tell me we're done, but we're not quite. I want to make sure we get any more pieces of herniation I can get. Not really getting anything more. Let's take another look. Laser. Just about a minute from being done. Any other questions?
No current questions, but we do have a comment coming from Charlie once more on YouTube saying, I didn't know the annular wall was also fibrous. Thank you.
Yeah, the annular wall, that's all it is, collagen and elastin. It's totally fibrous. The annular wall is made up of 24 layers of collagen and elastin crisscrossing to form a very strong wall of connective tissue. Last grab and we're done. Now I'm going to show you, Henry, in a moment, all the pieces of herniation. You know, some good ones that we got out right here.
Copy that.
All right. Scope off.
Ceiling on, please. Thank you.
Oh, right here, right here. Let me have that.
Oh, sorry.
Look at this. Henry, you see all these pieces of herniation?
Yes, we do.
So, and there's more right there. So we had a lot of herniation just coming out of the tube from the disc where the herniation was, and they just spilled out all over our blue towels, and that's what we have here and down there in the bag. Probably 50 pieces of herniation easily. No, more than 50. Probably 100 total for both discs, both sides. At least 50 on this side and probably 50 on the other. A lot of herniation. I think he's going to be very happy with his results. Any questions?
At this moment, no current questions.
Well, we're done. Thanks for joining us. And Henry, maybe you can show our discogenic back pain video.
Of course.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details,
Hi, I'm
please
Dr.
visit
Deuk
our
Majan.
website
We've just
or call us
completed
at
our free MRI
1-800
review at
Fix
Deuk
My
Spine
Back,
Institute, and I've
349-6922.
diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called the posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime.